Welcome to Discover La Jolla, where we shine a light on the jewel of San Diego, La Jolla, California. I'm here with Jim Macchione, our publisher for Discover La Jolla magazine, and our special guest today, Nick Macchione, and he's the Chief Health Officer for UCSD.
Thank you for having me here.
Yeah, it's nice to have you.
Yes, such a pleasure having you on Discover La Jolla today, and we're very excited to showcase your story, hear a little bit about your role at UCSD, and kind of dive into what got you started. So if we kind of turn back time, let's talk about your initial passion for healthcare and what made you decide to get into it.
Yeah, it's a great question. Like everyone has, their purpose and passion in life. I did not know when I was a kid that I was going to be working for an academic medical center down, when I was an older adult in my career. But in fact, I was immigrant child. My family immigrated from Southern Italy, and we immigrated to Northeast. And as in most of the newcomers and new immigrants, they would get their care from the local parishes, Catholic churches. And funny story, but true. As a kid, I remember my parents taking me to the parish nurse for our immunizations, and I remember it because although they did provide free care, which we really appreciated, they were pretty strict and not as friendly. And I remember this thinking. Wow, do I have to come again?
Yeah, is this it?
Is this it?
How it's going to be for the rest of my life?
But fast forward that, it really imprinted in my mind how this was really making a difference for my family. So that began my interest around public health. It began my interest around health care. It began my interest around helping families and others that didn't have the ability, maybe, being they're either new or they're down on their luck and needed some help. So that drive really guided my path in my career in healthcare and medicine and public health, both in my undergraduate, my graduate studies, and in my chosen profession, working in health and human services, and then fast forward in my current role as the Chief Health Officer.
And prior to being at UCSD, you were with the county. So what was your role there, and how did it shape this newly created position for you here at UCSD?
Well, I was, prior even coming to California, I was an executive director of a health planning organization in New Jersey, doing really well. And at the time, there was a gentleman that also migrated from the East Coast, a gentleman by Dr. Bob Ross, who was here in the early 90s. And he recruited me out, and I didn't know much about truly California, being a New Yorker. You had kind of notions about California. And all my friends said, well, go to La Jolla. You'll really enjoy it. I'm so glad I listened to their advice. I came out, and I was one of the original executives that actually created a new organization here in the County of San Diego called the Health and Human Service Agency. This is in 1998. That took all these separate departments that weren't really working together, came together, so it could better serve San Diegans in need, whether it was behavioral health or access to food or the elderly that needed some transportation, a whole array of services together. We called it more whole person care. And I did that for about 26 years. And I really enjoyed it. It was great. But I retired in 2023 and then joined UCSD.
And so this new role, what does this new role really encompass, and what's the vision now of your new role?
Yeah, it's a great question. This new role is actually a newly created position. It's the first of all the UCs in California as the Chief Health Officer. And when Chancellor Khosla and CEO Patty Mason created the position, it was custom built for me.
Got it.
Because it was bridging what the excellent world-class care we provide in our hospital, in our clinics, with the community, and leveraging our different partnerships in the community. And my 26 years at the county developed a lot of connections and partnerships.
You worked with all the departments.
Sorry?
You worked with all the departments.
I worked actually with all the departments and all the community-based organizations. And so UCSD is really expanding in all markets and throughout the county, and they wanted to create these partnerships because it wasn't just the great care we provide inside our hospital, it's also the care we provide for communities.
Right.
And that's what this role does. It's really building about the partnerships with the hospital and our community-based organizations.
And what are some of the initiatives that you're working on currently within your role?
Yeah, just last week, one of the major ones that CEO Patty Mason and I were working on as when I was back at the Health and Human Service Agency was around behavioral health and the need to really expand more behavioral health services. So just this past Tuesday, last week, the County Board of Supervisors approved a really first of its kind partnership with UCSD to build out at our most newest hospital, East Regional Medical Center, a behavioral health hub.
Okay.
Inpatient beds, outpatient, a crisis stabilization
Where
services.
exactly is that, Nick?
So that was the former Alvarado Hospital by College area, right by the base of San Diego State University.
Got it.
So that we took that on about a year ago. And so we're expanding and creating a behavioral health hub that serves not just that immediate area, but the entire county. And that is an example of the type of strategic partnerships to really improve services that we need in the region.
Right, right. Now, within that behavioral sector, what are you seeing that's quite common these days?
Yeah, behavioral health, if you survey every hospital CEO or clinic, they'll tell you behavioral health is one of their top priorities. We've seen a rise in the people in crisis. We've also seen a rise in the number of unsheltered homeless.
Right.
Who, not all, but many of them present with a behavioral health issue, be it mental health or a substance use disorder. And so there's a great need of how do we not only reach out to this population, how do we not only provide the right care, but how do we get them the right shelter? So this is a whole end-to-end, right? Engaging them where they're at in the street, getting them the type of care and support, and then getting them and placing them. And I think you both know we have pretty severe housing crisis and also shelter bed crisis. But so we're trying to work with all our partners.
So we need a lot more beds.
We need a lot more beds.
And people to attend to the beds.
Absolutely.
Huh. And so where in San Diego do you see like places like the Alvarado Hospital transformation happening? Like, are there other areas in San Diego that you're looking to expand to?
Well, we hope all others expand besides UCSD. We're partnering, with as many organizations that want to expand behavioral health. We were looking to expand in the North County. As I mentioned, we expanded now in the eastern part of the city. We are also working. We're very fortunate having perhaps one of the leading department of psychiatry in the country here at UCSD.
Okay.
And through their leadership, working with a lot of different clinics where we're providing that support. But the truth of the matter is, with all the might of UCSD, we can't do it alone.
Okay.
We really need all the other health systems and providers and the county government, everyone to join in.
Yeah, it really is a community effort.
Absolutely.
So you're reaching out to all those neighboring clinics and trying to pull it all together. Correct. Are you going outside of San Diego?
So, great point. So we're talking all about San Diego, and I want to come back to La Jolla too, because I know that's interesting.
That's where
but I love the fact that because truly, we're blessed being in La Jolla, we're blessed being in Hillcrest, we're blessed being in the College area, with East Region Medical Center, but our footprint goes into southern Riverside County.
Okay.
We have medical clinics there, but also Imperial County. So our CEO runs the El Centro Regional Medical Center. Our CEO, Patty Mason, for over 10 years has been traveling and trying to support that area. That was in just this morning's news about challenges that they need more health care. They don't have a lot. We've been trying to help that area with our services. So our footprint is beyond San Diego. And I think that's great. And that's the mission we have about really serving as many communities in need that we possibly can.
Right. And kind of jumping back into initiatives and kind of new things that are going on within your organization and the hospitals. I know we talked about this a little bit before we hopped on the podcast, but AI and how that's being integrated into medical care and into the hospitals and kind of as you're seeing it as we're evolving into healthcare.
Yeah, that is an exciting area of artificial intelligence.
Okay.
And for your viewers out there, we should take great pride that UCSD Health was one of the pioneers in artificial intelligence before it just got all so popular in the last many years. We were, through our clinicians, just doing remarkable work in our emergency department, using AI as a tool to help detect for our different x-rays and lung x-rays. This is when COVID was just beginning to present. And they were trying to develop an algorithm and using AI to really identify if someone was being at risk of being COVID-19 positive. And it was an amazing tool, to the point when then we had so many cases, anyone presenting with lung issues were probably presumed to be COVID. But in the early stages, it was really important. So that was already a glimpse for us. And that has now really mushroomed into so many different areas that we're in use. And then we are, blessed in San Diego, having our philanthropists with
Family.
the Jacobs family, absolutely, that they made a very large gift to create the Jacobs Center for Health Innovation. That is not just a kind of a virtual, but it will be a physical space where we're bringing in, if you want to think of it as a command center, all the different components that's connecting to what we're doing in our hospital system. And it is beyond exciting.
Super think tank.
It's a super think tank, but the bottom line is about how do we provide the best possible patient care, outcomes, and experience. So AI is a tool for our physicians, our nurses, our healthcare team is vital into the future as we're expanding.
Because that's such an important part of it all. I mean, you're talking about solving all these problems, but the experience that somebody gets in the healthcare system at UCSD is what you're also trying to improve the entire experience from start to finish.
That's right. Now, listen, the human experience, that nurse, that physician holding the patient's hand, that social worker, that can never be replaced by AI.
Yep.
And so there's always that human connection and touch. But AI is a tool, be it language, being it looking at all the different tests, making sure that we have the best possible understanding of the best care remedies for that individual. That's a great patient experience because they want to be helped.
Yep.
And AI is a tool that helps our clinicians do that.
And when is that center launching?
Well, that's a great question. That's underway right now. We're looking to have it stood up in about a year's time or so on the La Jolla campus.
Oh, great.
That's where it's right now being incubated.
So it's one of those cranes that we see up there on the hill?
You see cranes already.
Yeah.
You know that.
Lots of development.
We have an amazing new building standing up for clinical research right on La Jolla campus. We're going to be underway on expanding a new inpatient tower.
Really?
We have so many patients coming to La Jolla campus because, world-class care.
Yep.
That at any given time, we have, 50, 60, 80 San Diegans waiting for a bed.
Got it.
And so that's why we expanded to the East Regional Medical Center because we needed more space. But we are going to put up a new inpatient tower and another outpatient tower.
Good.
And a center for health innovation. So what's exciting is just the growth of La Jolla campus. But we're not forgetting about our Hillcrest campus. And I need to bring that up.
Okay.
Because that's the equal part of our success of great patient care, because all of our learners and faculty and top-notch staff also work in Hillcrest. And with that, already we have stood up, and that should be opening, I think, beginning of or sometime early next year, the McGrath Outpatient Pavilion.
Okay.
And if that is a remarkable outpatient facility right on the Hillcrest campus,
Great.
while we pursue rebuilding a brand new Hillcrest hospital. That's going to take longer.
Right.
But we're also putting up a state-of-the-art medical center there as well.
So there's lots to look forward to.
A lot to look forward to, yes.
So what's happening, and it's just kind of maybe a big question here and a macro question on our global stage with the elections coming up. Does that have any influence on what you and your team are doing on your initiatives?
You know, federalism, I call it federalism, which is things that flow from the feds to the state to us, definitely have an impact,
Okay.
to all of healthcare. Well, for starters, we in California are very dependent on the Affordable Care Act, somewhat
Okay.
called Obamacare.
Yep.
That's very important. People don't realize we have nearly 1 million San Diegans on Medicaid,
Wow.
which in California we call Medi-Cal.
Wow.
That's a tribute to the Affordable Care Act. Had we not had that,
Right.
there'd be a lot of people that wouldn't have any means to get their care, and they wouldn't come in more on a preventive when it's too late and then come in for more expensive and worse.
Procedures.
Correct. And perhaps not the best quality outcomes for them. So, yes, we need to make sure we pay attention at the federal level because we need to sustain and support those supports that we have for people that have access to health insurance. And in fact, even improve upon those things that we need for our state. So whoever gets into office, they're going to have that mandate, and we're going to work with them through our state, obviously, and the federal
Got it.
level. And so we're watching carefully.
Good. All right.
Wonderful. Well, is there anything else you want to add to the interview? Just things upcoming with UCSD, anything that you'd like to touch on a little bit more?
Yeah, thank you. So I'd be remiss if I didn't talk about the 13,000 team members.
Wow.
13,000.
That's quite a big number.
Yeah, we're a $4 billion annual system, but it's not the money, it's the people.
Right.
And the team members, these are clinicians or nurses or social workers or support staff or technicians, custodial, all of it is one single team. And we every day talk about how do we lead the way where everyone feels belonged and being cared for, so we can provide the best possible, experience for the people coming in to our hospitals and clinics. And it shows because in the second year in a row, we were ranked by U.S. News and World Report in the honor roll, which is the top 20 hospitals of all hospitals
Wow.
in the United States of America.
That's incredible.
Yes. And we got ranked 18th.
That's fantastic.
And with 11 of our 11 specialties in those rankings. And so I think when we think about that patient experience, it's how do we make it even better. So there's a lot of initiatives underway of thinking about constantly how do we improve that experience. And I personally had a up close experience with my son. More recently, he had to be rushed into the emergency room. He was dehydrated, and it was later in the afternoon. And all the stories people have about, oh gosh, you're going to be there for forever.
5 hours.
Yeah.
We were in a hallway because all the rooms are pretty much taken. And so here I am, an administrator of the health system. We know this, and I'm dad now
Yeah.
with my son, and the experience in the hallway was unbelievable. Trying to make sure he was comfortable, taken care of.
Checking in with you, letting
Checking
you know
in,
status
and-
when you're going to get in.
And at 8:00 comes on an overhead saying, quiet time. This is the emergency room, right? We do this across the hospital. So it's things like, and if you've been into a hospital or have ever been in, people are trying to recover.
Yeah.
They want to be as home-like environment. Things are quieter, right? Calmer.
A little less chaotic.
Things like that. And sure enough, things just really
Dialed
tempered down. And so I was so proud. I was really proud thinking it's not the stuff we say, it's the things we're actually doing
Right.
that matters for the patient. So, that's our charge, our mission. And it's not to just do it in La Jolla, which we're beyond ecstatic, and the 5,000 live births in La Jolla that every year we get, new babies. But it's trying to bring that experience broadly to San Diego and parts of Riverside and even Imperial County.
That's fantastic. What a major footprint. What a huge impact on Southern California. Thank you, Nick, for all your work.
Well, thank you.
Yes,
Impressive.
thank you. And if people are watching this and they want to learn more about what you do and your organization, how can they get in touch and get a little bit more information?
Yeah, great point. Well, I think we have our general, website of ucsd.health.edu, and bring you to that website. You can see all the different services and programs we have on it. If there's anyone out there that is looking to develop a partnership with us, absolutely, you can find me in our directory there. And we are constantly looking for partners and those that want to work with us in services, or if there's anyone there that has something in the heart that wants to donate their time or their treasures, we would be interested in talking to you there as well. We can connect you to people that can give you that conversation. We've been very fortunate. We have a very gracious community in La Jolla.
Yeah.
And they have
really give
donated
back.
quite a bit
Yep.
to not only our campus, but I know other health campuses. So we're very fortunate having an amazing community in La Jolla here in San Diego.
Awesome. Well, thank
That's
you so
awesome.
much for sharing, and thank you so much for coming on the podcast and all the incredible work that you and everyone that works at UCSD and the health department does.
Thank you.
And thank you for watching Discover La Jolla.